I'm Dr Jason McDougall. I'm a professor of pharmacology and anaesthesia at Dalhousie University, and I also chair the Scientific Advisory Committee at the Arthritis Society. So cannabis is from a family of hemp, the hemp family, and marijuana is pretty much the same thing. It's just more of a slang term, so we prefer to adhere to the scientific naming of cannabis. Cannabinoid is a chemical that's found within the plant, the cannabis plant, and it can also be a chemical that mimics the cannabis plant. So it could be man-made, or it could be naturally occurring in our bodies. So there are actually three different types of cannabinoid. There are the phytocannabinoids, which are the ones that are found within the cannabis plant. The synthetic cannabinoids, which are the man-made chemicals, the pharmaceutical preparations. And then there are the endocannabinoids, which are the naturally occurring cannabis-like compounds that occur and are produced in our bodies. There are many active ingredients in cannabis. The two most well-known ones are THC and CBD. THC stands for tetrahydrocannabinol, and that's the psychoactive component of cannabis. CBD is cannabidiol, and that has been shown to be effective at controlling pain and inflammation, but it doesn't have the psychoactive properties the same way that THC does. So medical cannabis is the cannabis that's prescribed by your doctor and could be in either the herbal form or the synthetic form, and there's some evidence to show that it can be effective in alleviating arthritis pain as well as inflammation and fatigue. There are different ways of administering medical cannabis. It can be either smoked or ingested in oral form, baked into cookies or produced into oil or butters. But there are also synthetic cannabinoids that can be taken as a tablet or as a spray underneath the tongue. Different strains of cannabis are different types of cannabis, and they vary in the amount of THC and CBD that they contain. And it's important to know that because they may have different impacts in various populations of patients. Well, just like any drug, there are a number of different side effects associated with cannabis, and so it may not be appropriate for all arthritis patients. So we really need more research to try and understand the safety profile of the different strains of cannabis. There's been a lot of experimental evidence to show that cannabis can be effective in treating the pains of arthritis as well as the inflammation and helping with fatigue. But we really need more clinical studies to try and understand the benefits and potential limitations of using cannabis. So further research into medical cannabis is required so we can understand the different subpopulations of patients who may be responsive to medical cannabis. We need to find out the effective dose of medical cannabis, some of the interactions with other drugs, as well as looking at different delivery systems.